Hi, my name is Dr. Scott Terrell, and I'm an anatomic pathologist at the College of Veterinary Medicine at the University of Florida. My main area of expertise and research is zoo and exotic animal pathology, and I'm actually stationed down in Orlando, Florida at the Walt Disney World's Animal Kingdom. Today I'm going to talk to you about diseases of pigs, which is an area of interest that I've developed over the last several years. And in the next 2 hours we're going to cover some of the diseases and pathology of pigs. So we'll get started. Pig questions, according to the overview or outline of the National Veterinary Licensing Exam website, compose approximately 7% of the exam questions that you'll be experiencing. So you can see it's a fairly significant portion of the exam, and it's one that most people are fairly weak on at this stage in their careers, whether or not you're a vet student or a postgraduate. When you talk about pig diseases, it's very important to understand that there are ages of pigs. There are groups and classes of ages of pigs that farmers, production people, and veterinarians use on a common day-to-day basis. These age classes are also important for the diagnosis of disease. Neonatal pigs are those that are generally 0 to 3 weeks of age and weigh around 4 kilograms in weight. The weanling and nursery stage are those animals that are around 3 to 10 weeks of age and weigh up to about 25 kilograms in weight. Grower finishers, these are the pigs that are getting a little bit larger now. These animals are 10 to 26 weeks of age, anywhere up to about 120 kilograms in weight. And then finally, the breeders and adults are about 6 to 8 months of age, up to and over 120 kilograms or 240 pounds. Most pigs that are going to market these days are going to market around 140 kilograms, anywhere from 280 to 300 pounds. There are a variety of different management schemes of pigs that are employed in the pig industry, and you may be experienced to these in a question format or in a real-life situation as backyard herds, where there are 1 or 2 or possibly up to 10 or 12 pigs. They're in a more intensive operation. They are operations very commonly referred to as all-in, all-out, where large numbers of pigs come into an operation in the nursery or grower stage and then are all harvested at a certain period of time as breeders or adults. SPF pigs are, of course, specific pathogen-free herds, and those are becoming more and more important in the pig industry as several diseases can be eliminated in some of these herds. Segregated early weaning is another term that you may hear as a management tool in pigs, where large numbers of piglets are moved out at an early weaning stage into a separate facility, again to reduce disease transmission. And then another term you may hear when you're dealing with pigs and swine industry is the term depop, repop, where there's a disease outbreak in a swine facility and the entire facility may be depopulated or killed or euthanized, and then the facility could be repopulated with healthy pigs. From a medical standpoint, from a management standpoint, it's important to know how to handle pigs. And of course, many people will remember the loops that were placed on the pig's nose for restraint, and that's probably one of the most common methods of restraint for blood collection. If you are going to collect blood from pigs, probably the most common sites of blood collection are the anterior vena cava and jugular vein. And we'll show you, point down here on our little cartoon in this region here. This is usually done using a 4 to 6 inch long needle, usually in the 20 to 18 gauge range. IV injections are usually done in the auricular vein or the ear vein, and can be done with the use or can be assisted the use of a rubber band to make the vein stand up. So blood collections in the jugular vein or vena cava, and IV injections in the auricular vein of the ear, often using a rubber band if you don't have an assistant. Pig diseases are quite easy as far as study and remembering, in that they can be easily classified into one of several categories. When you're thinking about pig disease, it's very important to think in a systemic basis, both from a multisystemic disease perspective and then going down the list of standard organ systems: respiratory diseases, GI diseases, neurologic diseases, musculoskeletal, reproductive, derm diseases, and then last but not least, there's always going to be a few miscellaneous ones that don't fit into any one category. We'll get started right off the bat with our multisystemic diseases. These are diseases that you're going to see or you're going to be described on a test that affect more than one system. So a disease that affects not only the lungs, but also the reproductive tract, or affects the skin and the kidneys. And when you're dealing with a diagnosis, whether it be in real life or in a testing situation, and you recognize that you have a disease that's affecting more than one body system, these are the diseases that you should consider. Erysipelas, caused by Erysipelathrix rhusiopathiae. Glasser's disease, which is probably a unique disease to pigs. Salmonella is a very common multisystemic disease. PRRS virus, or the porcine reproductive and respiratory syndrome, is very common. A new disease that's been described in the last several years is the post-weaning multisystemic wasting syndrome, caused by a circovirus. Pseudorabies is an important multisystemic disease, and of course vitamin E selenium can affect multiple organ systems as well. So we'll go through each one of these in a little bit more detail. Erysipelas is a very common, well-known disease of pigs, caused by Erysipelathrix rhusiopathiae. It's a gram-positive rod bacteria, and it's found in the environment. It's a very common bacteria found in the environment, and most pig herds that aren't managed as SPF herds will have Erysipelathrix carriers within the herd. The most common diseases that are seen with erysipelas, of course, is the classic diamond skin disease, but in addition, the multisystemic nature of the disease causes evidence of arthritis, can cause severe endocarditis, and can cause necrosis in any organ system in the body. Here's the classic photograph of diamond skin disease in a pig, showing the blotchy red areas of discoloration of the skin. Here's an opened heart from an adult pig that was affected with erysipelas. And here in the atrioventricular valve region here, and also over here in this region, you can see large thromboemboli that are associated with just massive colonies of bacteria, in this case Erysipelathrix rhusiopathiae. Treatment for Erysipelathrix can be attempted, and I'm a pathologist and I don't treat a lot of animals, so my details on treatments is going to be fairly limited. But I think it's more important that you can recognize the disease and understand some of the management of the diseases rather than worry about specific treatments. But in the case of erysipelas, you can attempt treatment. Penicillins and tetracyclines can both be effective, with probably penicillins being the first line defense. And then as far as control of these animals, or control of this disease, sanitation is very important, and basically trying to reduce the carrier status in your herd or in the flock of pigs. And then there is a vaccine that is not very commonly used, but it can be used to vaccinate piglets at weaning, and then again at about 6 months of age. Glasser's disease. Glasser's disease is our second multisystemic disease and is one that is unique to pigs. The lay term for Glasser's disease is polyserositis, caused by a bacteria called Haemophilus parasuis. Haemophilus parasuis is endemic in herds. It's, again, another environmental pathogen that is usually initiated by some severe stressful event. Glasser's disease is a disease that can usually be fairly easily recognized in a post-mortem sample, and that's how you're going to diagnose Glasser's disease. You're not going to see and chances are you're not going to see a clinically affected animal. These are going to be animals that are going to die and are going to require a post-mortem examination, as is common for many pig diseases. What you see with Glasser's disease is evidence of pleuritis, pericarditis, peritonitis, and even meningitis. And what you see are thick strands of fibrin covering all of these organs. We have a photograph of Glasser's disease here showing basically the heart has a kind of a shaggy, tan appearance to it. You can see the mesentery back here is almost totally covered by this shaggy tan material. And this is all fibrin, inflammatory exudate that's covering multiple organ systems in the body. It should be a fairly classic diagnosis, whether you see it in a photograph or whether it's described to you on an exam situation. To diagnose Glasser's disease, you should be able to go with a pretty good suspicion from a post-mortem examination. You can try and culture it. It's an aerobic pathogen, but it is very difficult to culture. So in most cases, you're going to make the diagnosis based on your clinical impression and on your post-mortem findings. Treatment can be attempted if you were to make an ante-mortem diagnosis, or if you were to diagnose it in a dead pig with evidence of other sick pigs. And again, the penicillins and tetracyclines are the most common first line of defense against this disease. The prevention and control of Glasser's disease is fairly simple in that, again, it's a disease that's manifested by stress and occurs in a stressful event. So reducing stress in a pig population is important. And then there is a vaccine for Glasser's disease as well. So if vaccinate is one of your choices, it certainly might be an applicable choice. Salmonella. Salmonella is a disease that we're going to come back to over the next little bit of time here. And salmonella is a very common multisystemic disease in pigs. Probably the most common species of salmonella involved with pig diseases are Salmonella cholerae and Salmonella typhimurium, remembering that Salmonella typhimurium can be a zoonotic disease. Salmonella is found, again, as a low-level endemic disease in herds, and there are carriers. There are certain Salmonella carriers usually found in a herd. And Salmonella is a cause of septicemia, of diffuse systemic inflammation. So inflammation of the heart, of the intestinal tract. You may see pneumonia. You may see evidence of vasculitis and thrombosis. And probably the most classic thing that you'll see in a Salmonella-infected pig, clinically or in a dead pig, is this severe hyperemia and congestion of the skin. You see a large area around the jowls here that show dark reddening. This would be very warm tissue. And then another classic Salmonella finding in pigs is this ear discoloration or hyperemia of the ear. And that's associated with infarction of the ear. And that's a very common presenting sign, both clinically or at a postmortem, of salmonellosis in a pig. Salmonella is, of course, diagnosed by aerobic culture. It can be treated in a herd situation by treating the feed or the water with neomycin. And in an individual valuable animal, such as a show animal, one that's not destined for the food market right away, you could use Ceftiofur or Naxel as an individual animal treatment. Prevention and control of salmonella is usually by sanitation is the most common way. Vaccines are not commonly used, although there are a few vaccines available. And salmonella has been such a significant problem in some pig herds that the all-in, all-out management tool is used as one of the methods to control this disease. Those are the bacterial diseases that we're going to talk about as far as multisystemic goes. When we start talking about viral diseases, the first one we want to mention is the porcine reproductive and respiratory syndrome. Right in the name, it implies that it is a multisystemic disease affecting both the reproductive tract and the respiratory tract. PRRS is caused by an arterivirus, and its clinical signs are most commonly seen in neonatal animals. So these are that young age group that we talked about at the beginning. You may see in a reproductive female, you may see evidence of stillborn and mummified fetuses. In an adult animal, you may see anorexia, lethargy, and fever. In an adult animal, we talked about salmonella causing cyanosis of the ears, but you can also see that with PRRS virus. You may see evidence of respiratory distress, hence the name reproductive and respiratory syndrome. PRRS virus is a very common cause of damage to the lung, allowing for secondary bacterial pneumonias, and we'll talk about that more in the pneumonia section. And PRRS virus is a very common cause of abnormal estrus. These animals may come into estrus again unexpectedly. They may abort and have mummified fetuses, and all this will cause abnormal reproductive cycling. PRRS virus can be diagnosed probably by serology is the most common diagnostic technique. Virus isolation can be done, and a few cases that I've dealt with have been isolated at the National Veterinary Services Laboratory in Ames, Iowa. From a post-mortem standpoint, or if you were to have mummified fetuses to take diagnostic materials from, there is an immunofluorescent antibody test. There is an immunohistochemistry test that are very commonly used to diagnose this disease in tissue samples in the United States. Treatment, there really is no treatment for this disease. It's like all other viral diseases where stress is reduced and supportive care is given. As far as control goes, again, this is another disease where closed herds, these all-in, all-out operations are very commonly used. And there is a PRRS virus vaccine that is commonly used in the swine industry as well. So as far as control, vaccination, and herd management are the two biggest tools. A new disease that many of you may not have been exposed to is a disease called post-weaning multisystemic wasting syndrome. And this is a disease that's kind of burst onto the swine disease scene recently and has become a very important both economically and from an animal standpoint. The post-weaning multisystemic syndrome is caused by porcine circovirus 2. It's a relatively new disease as far as it's been described in the literature in the last 5 years or so. And it's been responsible, they found it to be responsible for many of the signs that they've classically associated with PRRS virus infection. So many things they always thought was PRRS virus actually turns out to be circovirus. These animals, it's mostly in the weanling age group of pigs. These animals will begin to waste despite an adequate appetite. Probably the most dramatic and pathognomonic sign of this circovirus infection is marked enlargement of lymph nodes. Submandibular lymph nodes, prefemoral, prescapular lymph nodes will all be enlarged and can be noted in a clinical situation. And then these animals will also develop pneumonia in most cases, and so they'll have not only the lymph node enlargement, but also can have evidence of breathing difficulties and respiratory distress. Diagnosis of circovirus infection at this time is pretty much a postmortem diagnosis. These animals can be necropsied, tissues collected for histopathology, and serology can be performed on blood samples, or immunofluorescent antibody tests can be done on tissue samples. On histopathology, the classic finding, and one that could be perhaps asked in an exam situation, is that circovirus creates large basophilic or blue intracytoplasmic viral inclusions. And those are most commonly found in the lymphoid tissues in these animals. So lymph nodes, spleen, and some of the gut-associated lymphoid tissues as well. You can also find the viral inclusions present in the lung. Treatment for the post-weaning multisystemic wasting syndrome is, as it is with all other viruses, very difficult. There is no specific treatment, and it's basically supportive care, and then many herds choose to euthanize affected animals to remove them from the herd. Control, this is still a relatively new disease. There's a lot of research being done with it, and it's difficult at this time as far as control, and it is thought that carrier animals can be very important in the transmission of this disease. So it is a significant issue for the swine industry. Pseudorabies virus. Our third virus that we want to talk about as far as a multisystemic disease. Remember that the lay term for this disease is Olszewski's disease. It's a herpes virus, an alpha herpes virus specifically, that affects swine, dogs, cats, domestic ruminants, wild swine. Basically affects almost all species, all mammalian species, but it is not a zoonotic disease, and it is important to remember that pseudorabies does not infect humans. Pseudorabies affects animals based on their age, and in baby piglets or in the neonate phase, the neonate age group, pseudorabies can have up to 100% mortality. It manifests itself clinically as evidence of severe neurologic disease. These animals may have oral ulcerations, they may vomit and have severe diarrhea, and you can see ulcerations in a postmortem sample extending all the way from the oral cavity down into the esophagus. As the animals age into the weanling and grower phase, the percent mortality actually drops. So now, in the neonate phase, we may see 100% mortality. In the weanling grower phase, we may see 60% to 40% mortality. In these older animals, pneumonia is probably the most common sign of pseudorabies virus infection. You can see neurologic disease, but it's not nearly as common. You may see some vomiting, and you may see extreme pyrexia or hyperthermia in these animals associated with probably with the pneumonia and the neurologic disease. As the animals age into the adult stage, the infection of pseudorabies is often inapparent or subclinical in that we don't see evidence of disease in these animals, although they may be harboring the virus. Pseudorabies is a reportable disease in most of the United States, and so if you do have a diagnosis of or a suspicion of pseudorabies, you should contact the state veterinarian. Diagnosis is made in most cases on dead animals by necropsy. Histopathologic tissues can be examined from the brain and from the GI tract, looking for the characteristic intranuclear inclusions. From a clinical standpoint, there is a serum neutralization test to test for exposure to this disease, and an ELISA can be used as a screening test in a herd situation to look at incidence of pseudorabies infection in a specific herd. Prevention. This disease is one that's managed very strictly by maintaining closed herds, these all-in, all-out operations that we've talked about. Quarantine is very important when bringing in new pigs, and especially in the southeastern United States, in Florida, Georgia, Alabama, it's important to reduce access of backyard swine flocks to wild animals, specifically wild pigs, because there are several wild pigs herds throughout the southeastern United States that can act as carriers of pseudorabies virus. So it's important to minimize contact between your production animals and any wild species. And there is a vaccine for pseudorabies. However, that vaccine is controlled by the USDA and state authorities, and permission must be granted to use the vaccine in most instances. Clinical signs of rabies, pseudorabies. It's called pseudorabies because it can mimic some of the signs that we see in rabies. And here's a dog infected by pseudorabies that's actually foamy at the mouth or has evidence of hypersalivation. And then remember, another term used for pseudorabies is mad itch. These animals will become extremely pruritic and will scratch themselves almost to death. And this is a Holstein cow with a large bear patch on her side that was infected by pseudorabies virus and basically rubbed all the skin off of her flanks. Use of the vaccine, as we said before, is regulated by many of the states. And pseudorabies is a disease that there are some federal monitoring rules in place for, and that all animals over 6 months old must be tested for pseudorabies via serology. 25% of the herd may be tested every 3 months, or you can test 10% of the herd every month to maintain your pseudorabies-free status. So this is a disease that's taken very seriously, and there are some regulatory implications associated with pseudorabies. The final multisystemic disease that we're going to talk about is white muscle disease, or another name is sometimes called mulberry heart disease. This is not a bacterial or viral infection, but is a nutritional syndrome that's most commonly seen in the nursery stage or sometimes in the grower phase of these pig operations. It's associated, of course, with vitamin E or selenium deficiency. Vitamin E selenium deficiency is seen in these pig herds associated with rancid fat in the feed, which destroys vitamin E selenium. Feeds that are high in propionic acid, the propionic acid can bind to and remove the vitamin E selenium from being accessible in the diet. And then feeds that are sometimes prepared in the Midwestern United States can be naturally selenium deficient, and there may be a source of vitamin E selenium deficiency in a herd. Clinical signs can range from muscle weakness to acute death in these animals, depending on which organ system is affected. And again, this is a disease that may affect not only the musculature system, but also the cardiovascular system. Animals with muscle changes may just present with muscle weakness or lameness. Animals with cardiovascular disease, where there's severe necrosis of the heart, may present to you as an acute death. Diagnosis of vitamin E selenium deficiency is, and in the case of an acute death, is made by a necropsy, looking for your classic signs associated with heart disease. Hydropericardium, or fluid within the pericardial sac, fibrin within the heart muscle itself, and you can often see areas of myocardial hemorrhage and necrosis. A unique syndrome associated with vitamin E selenium deficiency in pigs is called hepatosis dietetica, where there's diffuse massive necrosis of the liver. In a postmortem specimen, you can confirm your suspicion of vitamin E selenium by taking a chunk of liver and sending it off for vitamin mineral analysis, and a mineral level of less than 0.5 micrograms per gram of selenium is diagnostic for vitamin E selenium deficiency in a pig. Here's a fairly classic textbook picture of mulberry heart disease associated with vitamin E selenium deficiency, showing these large areas of pallor within the heart. So, we covered our multisystemic diseases, and again, if you're recognizing diseases in the real world or in a testing situation that affect more than one body system, those are the diseases that you can concentrate on. Now we're going to get into specific organ systems. So if you have a disease that you're dealing with and it's targeting specifically the cardiovascular system, there are basically 5 differential diagnoses to think about. Encephalomyocarditis virus is a viral infection of the heart. Hog cholera and African swine fever are both exotic diseases that can target the heart of the pigs or blood vessels of pigs. Erysipelas and vitamin E selenium we've already talked about. So the list of cardiovascular disease causes in pigs is semi-short. Encephalomyocarditis virus is caused by a cardiovirus. In neonatal animals, it's often a cause of sudden death. But in older pigs, it can be a cause of subclinical myocarditis and chronic heart failure, basically in these older animals. Encephalomyocarditis virus is probably most commonly seen in pigs, and incidentally is also commonly seen in elephants and certain primates. The pathology associated with encephalomyocarditis virus is most commonly noted to be hemorrhage within the heart and pinpoint areas of necrosis in the heart as well. So these are hearts that you're going to look at, and they're going to have large streaks of hemorrhage in them, or they're going to have little pinpoint tan to white foci present within the heart. Here's a very nice picture of encephalomyocarditis virus in the heart of a pig, showing, here's heart here, showing these areas of pale tan discoloration within the heart muscle. Okay, you can see they're very focal areas, and one of the first diagnoses that pops to mind in this case should be encephalomyocarditis virus. Other cardiac diseases that we want to talk about real quickly, we want to go over hog collar and African swine fever are both foreign animal diseases. We'll talk about them a little bit more detail at the end. These are viral diseases that both will attack the cardiovascular system in that they infect blood vessels and will cause severe vasculitis, hemorrhage, and bleeding in multiple organ systems. Hog cholera typically causes splenic lesions, and African swine fever often manifests itself as lesions in the kidneys as far as leaky blood vessels in the kidney. Erysipelas we talked about in regards to the heart, and that erysipelas is a common cause of valvular endocarditis. And if we remember back to our photograph of the large bacterial thromboembolism in the atrioventricular valve of the heart. And then, of course, vitamin E selenium deficiency we mentioned as the cause of Mulberry heart disease and cause of necrosis and generation of the myocardium. So those are the cardiovascular diseases. Very simple. Again, if you see a disease that's specifically targeting the heart or blood vessels, here's your list of differentials. Respiratory diseases. Respiratory diseases are very important in the swine industry and probably one of the most common diseases that you will diagnose. A fairly short list of diseases that specifically target the lungs, but ones that we're going to talk about are atrophic rhinitis, a unique disease to pigs, swine flu, swine mycoplasmosis, actinobacillus, pasteurella, and then there are a few parasites that can actually infect the lungs of pigs. Atrophic rhinitis. This is a disease that's unique to pigs, and many people, of course, will remember atrophic rhinitis to be a deviation of the snout or malformation of the snout of the pigs. It's associated with a dual infection of Bordetella bronchoseptica and Pasteurella multocida, and it's the toxins that are released by these bacteria that actually cause the bone changes that manifest themselves clinically as deviations in the snout. A predisposing factor in some cases in atrophic rhinitis is thought to be high ammonia levels, which again is irritating to the mucous membranes of the nasal cavity and can predispose these animals to bacterial infection. Clinical signs of atrophic rhinitis in pigs include sneezing, sniffling. They may bleed from the nose or have evidence of epistaxis. These animals may have excessive lacrimation or tearing because with the deviation of the snout, there's disruption of the lacrimal ducts, and the lacrimal ducts can no longer drain through the snout, and so the animals will appear to tear more commonly. And then, of course, the most dramatic clinical sign associated with this disease is a severely twisted snout. Diagnosis, and this is one of those trivial things that's very important to remember. As far as atrophic rhinitis is concerned, for a diagnosis, the classic textbook industry standard for diagnosis is to actually cut the snout in a cross-section at the second premolar. And that gives you a standard view of the snout to look at the bones and to try and determine if there's some deviation or bone damage. You can culture the snout looking for either organism to give you a presumptive diagnosis of atrophic rhinitis. Treatment, probably the most common treatment in a herd situation is to put tetracycline antibiotics in the feeds, and that can be very effective in controlling this disease. Control and prevention is important. This is such a common disease in the swine industry that, again, the all-in, all-out management system, reducing stress in these animals to reduce secondary bacterial infections, and, of course, lowering the ammonia levels in the environment and keeping the air clean to prevent mucous membrane irritation. Here we have a classic textbook picture of atrophic rhinitis showing you deviation of the median bone here. And then you can see that there's marked asymmetry between the right and the left sides. So not only is there bone deviation, but there's also atrophy of bone. And this snout was, of course, cut at the second premolar for that standard view of the snout. Swine flu. Now we've moved from the snout down to the lungs, and we're going to talk about viral disease of swine. That's fairly important. Swine flu is caused by influenza virus. It's a fairly easy one to remember. Remember that influenza virus of pigs does have some zoonotic potential, and the swine flu has been implicated in certain human diseases. Of course, the massive, severe 1918 flu that killed millions of people around the world was supposedly a swine flu virus, and so it does have some potential for zoonosis, even though in most cases it's a fairly minimal risk. Outbreaks of swine flu, as they are in any species, are associated with severe stresses. So usually some sort of movement or extreme weather condition. These are animals that are put on a truck in the grower phase and shipped across the country to a butchering operation, or perhaps neonatal animals that are weaned and then shipped to a grower-finisher operation and are stressed out for whatever reason. This disease also occurs very commonly in the wintertime, where these animals are exposed to severe changes in temperature during movement. Swine flu is a disease that does not kill a lot of pigs, but will make a lot of pigs sick. So you may see in a herd affected by swine flu up to 100% morbidity, but the mortality may be very low unless there's some sort of secondary bacterial contamination. Diagnosis of swine flu: classically, on a necropsy specimen, you may see evidence of a cranioventral pneumonia, which is a little unusual for a viral disease. But more commonly, again, this disease is not going to kill pigs, so clinically, what you're going to notice is a large percentage of pigs that are ill with respiratory disease. It's a moderate to mild disease for the most part, and that this disease can be diagnosed based on clinical signs and by serology or fluorescent antibody testing of nasal secretions. So nasal swabs, throat swabs, tissues if they're available, can be tested by the fluorescent antibody technique, and there are serologic tests available as well for diagnosis of swine flu. Treatment, as in all other viral diseases, is supportive, and prevention of this very important disease, again, reducing stress, maintaining closed herds, not moving animals in the wintertime, not exposing these animals to extreme stressful events, transport unless it's absolutely necessary. And then it's very important, as it is with most viral diseases, to control secondary bacterial infections such as Pasteurella or Actinobacillus, which we're going to talk about in just a second. Mycoplasma. This is another pneumonia of pigs that's fairly unique. Its lay term, or the common name of this disease, is enzootic pneumonia, and that's important to remember, I believe. So mycoplasma pneumonia is also called enzootic pneumonia. Mycoplasmosis is the most common cause of a chronic low-grade pneumonia in pigs, and it's very commonly seen and diagnosed. It's a chronic, mild, non-productive cough, again, associated with low mortality, but it can affect a fair number of pigs in a herd. It's not as dramatic as a swine flu outbreak, but it can affect several pigs in a herd without killing many of them. Mycoplasma, again, is a good primary invader to allow for secondary bacterial invasion by some of the pathogens we're going to talk about in a minute. Necropsy, a classical textbook description of mycoplasma pneumonia in pigs, is this plum-colored lung. Especially the cranioventral region will be very dark purple, and that's a classic textbook description that you should be able to recognize. You may want to culture these lungs in a diagnostic situation to rule out a secondary bacterial infection. And then on lung tissues or on respiratory secretions, there is a fluorescent antibody test available, similar to swine flu. And here's not such a good picture, but a photograph of the lungs of a pig. Here's the trachea coming in, and here's the lungs here. And down in this region here, you can see a very dark purple discoloration of the lung. So there's a cranioventral plum-colored or dark purple discoloration of the lung. That's a fairly classic textbook for mycoplasma. If you had these tissues to diagnose, either on an exam or in a real-life situation, you just collect a small section of lung and send it off for fluorescent antibody testing to confirm your diagnosis. You would also want to culture this lung to make sure you didn't have a secondary bacterial pathogen. Treatment for mycoplasma is commonly done with lincomycin antibiotics in the feed, following the appropriate withdrawal times, of course, and we won't get into specifics there. And prevention is basically a management tool. So again, the all-in, all-out herds, sanitation, reducing stress, reducing secondary bacterial complications, and perhaps managing these guys prophylactically with antibiotics in the feed. Again, lincomycin commonly used. So we talked about two respiratory diseases that cause low mortality but can affect a large number of pigs. Now we're going to switch to a disease that actually will kill a large number of pigs fairly quickly. So it's fairly easy to differentiate between the diseases we're going to talk about. Actinobacillus pleuropneumonia is the cause of contagious pleuropneumonia of pigs. This disease is seen usually in intensive grower-feeder operations. So these are the older pigs that are in the grower-finisher stage. They may be in the early grower stage. The disease is found or probably brought into herds through inapparent carriers. So again, all-in, all-out operations and quarantine are important. And most commonly, this disease is associated with a peracute or acute severe pneumonia. There are some chronic cases, but it's much more common for Actinobacillus pleuropneumonia to cause an acute pneumonia in these animals. Clinical signs are much more dramatic than the two diseases we've already talked about and are associated with very severe respiratory distress and outright sudden death. So in stark contrast to the swine flu and to the mycoplasmal pneumonia, this contagious pleuropneumonia often kills pigs. Diagnosis in most cases is going to be a necropsy because these animals will die. And what you're looking for is a very severe necrohemorrhagic fibrinous, just a nasty pleuropneumonia. So a pneumonia that affects not only the lung itself, but also the pleural covering of the lung. This disease, for whatever reason, seems to target the caudal or diaphragmatic lungs in most cases. And basically, diagnosis is often made based on your clinical impression and your gross necropsy. Culture of the organism is difficult. There is a serologic test to look for exposure or antibodies or titer to Actinobacillus. Treatment is commonly not going to be done in that this disease, again, is going to kill very rapidly. But in an individual, valuable animal, such as a show pig, NAVELE is a very potent antibiotic that can be used. And in a herd situation where you had this disease going through a herd and you wanted to try and prevent it, penicillin, some of the penicillins can be used either in individual animals or perhaps in a feed situation. There is a vaccine for Actinobacillus pleuropneumonia that is used, contagious pleuropneumonia vaccine that's used for control. And here we have a very good example of contagious pleuropneumonia. This is a lung from a pig. Basically, you're just looking at the right lung of a pig, and you can see this. This is a terrible-looking lung, red to black discoloration. It affects not only the pleura surface, but also if you cut into the lung, you'll see that it affects the pulmonary parenchyma. So if you were to see this in a real-life situation or on a testing situation, either a photograph or be described to you, what you want to key in on is that this is a very severe pneumonia, that it affects not only the pleura, but also the pulmonary parenchyma, and you should have a fairly simple diagnosis. The second bacterial disease that we're going to talk about is Pasteurella multocida, a very common cause of pneumonia in most species, and this is probably the most common bacteria that's isolated from pig lungs. And that's because it's a very good secondary pathogen. It's very good at invading damaged lung tissue. We talked about mycoplasma and swine flu as causes of mild pneumonias. But those viral and mycoplasmal diseases can set the lung up for secondary Pasteurella infection. And that's very commonly what occurs in these animals. These animals will have a moderate to severe pneumonia. Clinically, they may have a moist, productive cough, so they may cough up sputum, purulent exudate. They may cough up fibrin and necrotic debris. These animals will develop dyspnea and severe respiratory distress, and probably in the range of 30 to 50% of these animals may die without treatment. Diagnosis at necropsy, if you are dealing with a dead pig or you're necropsying pigs, is you'll see a very classic suppurative cranioventral bronchopneumonia. So this is a pneumonia that's similar to what you'd see in a shipping fever complex in a cow or any other species affected with Pasteurella, in that it's a very suppurative lesion in the lung. You can see evidence of pleuritis, however, it's not nearly as common as with the Actinobacillus. Treatment in this case, in cases of Pasteurella, are with antibiotics and reducing stress, trying to control underlying viral infections, and treatments are most commonly done, as with most pig disease, with the penicillins and tetracycline antibiotics. Control. If you're diagnosing Pasteurella pneumonia in a number of pigs in a herd, or if you're diagnosing it on a common basis, you should be looking for an underlying cause. So you should be submitting tissues for mycoplasmal culture, for immunofluorescent antibody testing for mycoplasma or for swine flu, because there's often some underlying cause if you're dealing with a lot of Pasteurella cases. So remember that in a testing situation, to always look for a second disease if you're diagnosing Pasteurella. You can medicate animals in a feed and water for prevention if you have a chronic problem with pasteurellosis as well. Here's a very classic textbook picture of Pasteurella pneumonia. The lungs oriented a little different. This is cranial over here, and caudal is back up here. And you can see the classic consolidation, reddening, and collapse of pneumonia in this lung. And if you were to incise this lung, a large amount of pus or purulent exudate would exude from the pulmonary parenchyma. Notice that this disease does not, in this case, affect the pleura, and so it looks very different from the cases of contagious pleura pneumonia that I showed you earlier. Last but not least, we want to talk about two parasites that can cause verminous pneumonia or parasitic pneumonia. Ascarisillum is an ascarid nematode parasite that can migrate through the lung and cause a very mild pulmonary lesion. The lungworm of pigs, as a trivial fact or as an important fact to remember for a testing situation, the lungworm of pigs is called Metastrongylus elongatus. I know it's not on this slide, but Metastrongylus elongatus is the lungworm of pigs. Ascarids are most commonly found in pasture animals. So an animal that was housed on a concrete production facility would probably not have problems with these parasites. Parasites can also set animals up for secondary bacterial infections by Pasteurella. And then with ascarids, you may also see evidence of scarring in the liver, commonly referred to by the farmers as milk spots. You may see evidence of parasites in the GI tract with ascarids, and they can be treated with your standard anthelmintics. But I think it's really important to remember is that the lungworm of pigs is Metastrongylus elongatus, and just for some more details, the intermediate host for that parasite is the earthworm. So, we just wrapped up respiratory diseases. Again, those are diseases that are specifically targeting the respiratory tract. We've got two mild diseases, so if you've got low morbidity, low mortality, you're looking at swine flu or mycoplasma, and two more severe diseases, Pasteurella and contagious pleuropneumonia, if you're seeing terrible pneumonias or pigs outright dying. Probably the second most important category of diseases of pigs are the GI diseases. These are diseases that are fairly easy to diagnose based on the age of pigs and based on the kind of signs that you're seeing. We're going to break these diseases down into the stomach, small intestine, and large intestine. And this is where it's very important to understand age groups and to know what age group of pig you're dealing with. Because the small intestinal diseases tend to target the younger animals, and the large intestinal diseases tend to target the older animals. It's very simple. First, we're going to talk about the stomach, and then we'll go through a list of small intestinal diseases, as well as some of the large intestinal diseases. Stomach. The classic stomach or gastric disease of pigs is gastric ulcer disease, and this is a very important disease, still very commonly seen. Ulcers in the stomach of pigs are almost always found in the pars esophageal of the stomach, so in that specific region of the stomach is where you see these ulcers. These ulcers can be severe enough that they penetrate blood vessels or they perforate the stomach, leading to an animal that's called a bleed out, or an animal that hemorrhages very severely and dies very acutely. There are a variety of predisposing factors that are associated with gastric ulcer disease in pigs. Pigs are a fairly high-stress animal to begin with, and if you add increased stress on top of that, whether it be social stress, crowding stress, environmental stress, that can lead to gastric ulceration, just like it would in any other species. Finely ground feeds, so feeds that are very finely ground to powdery to very granular, can increase the amount of hydrochloric acid secretion in the pig's stomach, also leading to ulcers. And then there's been some historical association with vitamin E selenium deficiency and gastric ulcer disease in pigs. However, if I was going to be managing this or dealing with this in a testing situation, probably stress and the finely ground feed are the two things that I would concentrate on. What do you see clinically? Well, you may see evidence of melena, or digested blood passing from the rectum, because these ulcers will bleed. You may see in a post-mortem specimen, or if you were to do endoscopy, which would be very rare in a pig, you may see ulceration of the squamous pars esophageal once again. And then these pigs will be painful. Gastric ulcers are painful just like they are in humans, and the animals may lose condition and not eat. Here's a classic photograph of a bleed-out pig or a bleeder pig, and they're also called bleached pigs because they're so white. And basically this pig is just basically dropped dead on the farm, and its belly is distended, and it's distended by blood because this gastric ulcer has perforated and bled into the abdomen. And basically this is just a very white, blanched out pig that died of acute, severe hemorrhage. That's the stomach disease. Very simple. One stomach disease to think about. So if you're dealing with animals that are bleeding out or showing evidence of gastric ulcers, you've got a diagnosis. Now we'll move to the small intestinal diseases. And again, it's important when you're in a real life situation or in the test to know what age class of pigs you're dealing with. Because when you're dealing with the young animals, almost always your diseases you're going to be seeing are the small intestinal diseases. So for example, the first one we'll talk about is cholebasilosis, caused by E. coli, of course. E. coli is the most common cause of diarrhea in piglets less than 5 days of age. So if you're dealing with a 1, 2, 3, 4-day-old pig, the first differential that pops into your mind should be E. coli. The clinical signs associated with E. coli are that these animals will have very clear, watery feces for the most part. It may be kind of pasty and brown, but for the most part it's going to be very clear, watery, profuse diarrhea. These animals are young and are very susceptible to dehydration. They become very depressed, and the younger they are, the more likely they are to die. So a 1-day-old pig with this disease may not survive, whereas in just a few days the pig may be strong enough to resist the infection. But you're still going to see this very profuse, watery diarrhea. Diagnosis in a clinical situation is made, classically, the textbook description is you can actually measure the pH of the feces. And it's said that in cases of cholebasilosis, the pH of the feces is actually alkaline or greater than 8. Probably a more reliable diagnostic tool is just to go ahead and culture the feces and look for a pure or overwhelming growth of E. coli on your aerobic bacterial cultures. If you are necropsying pigs that are dying of E. coli, you're looking for a very dilated, gas-filled small intestine. The bacteria does not actually attack the intestinal tract. It's a toxin that's released by the bacteria that causes the watery diarrhea. So you're not going to see classic signs of enteritis or severe intestinal disease. Well, all you're going to do is see very fluid-filled, gas-filled small intestines. Treatment can be attempted on a herd basis with, again, the penicillins or ampicillin and the tetracyclines. Gentamicin, of course, is going to be not commonly used, and probably should just wipe that off the slide and forget about that. So in a herd situation, concentrate on the penicillins and the tetracyclines, and then in a very valuable animal, again, in a show situation or a 4-H situation, you can use other antibiotics. Control, this is a disease of poorly sanitized herds, so you want to make sure the sanitation is good. The farrowing area should be very thoroughly sanitized, should be clean and spotless, and that there is a vaccine that can be given to the sows to protect the neonatal piglets. Here's a photograph of a pig with cholebasilosis, trying to demonstrate the small intestines, which, if you look at them, they're fairly normal looking. They're not reddened, they're not thickened. They look like fairly normal small intestines, but they're full of fluid. And this pig basically has an E. coli diarrhea, which is just basically a very fluidy diarrhea, and this animal died of dehydration. The second disease that we'll talk about, again, in young pigs, affecting predominantly the small intestine, is transmissible gastroenteritis. This is a disease that's unique to pigs, caused by coronavirus, and of course everybody knows that a coronavirus is also the cause of feline infectious peritonitis. You can see epidemics of TGE in swine herds that will affect all the pigs. However, it's much more common to see small endemic outbreaks of TGE in pigs that are between 1 and 8 weeks of age. This is a disease that most commonly occurs in the wintertime, probably associated with the stress of environmental temperature change. TGE is a disease that can be diagnosed clinically because these animals will actually have diarrhea that will contain undigested milk. And that's fairly classic for TGE. So in a testing situation or in a real-world situation, if you're looking at piglets between 1 and 8 weeks of age, so you're starting to get into your nursery phase, maybe your weaners, these are pigs that are going to have undigested milk in their feces, and you should be thinking about TGE. In the older animals, in the grower finishers, they may have a mild diarrhea that tends to go away after about 7 days. But this disease is most important, once again, in these young animals, anywhere from 1 week of age up to sometimes 7 or 8 weeks of age. The younger the pigs are, the higher the sickness and mortality is. So animals that are affected at 1 week of age may have a significantly higher mortality than some of the 2, 3, 4-week-old piglets that are affected. Diagnosis of TGE can be made based on clinical signs. There is a ELISA test for serology to look at exposure to TGE, and you might want to look at rising titers in a live specimen to look for evidence of recent exposure to TGE. And you can do immunofluorescent antibody testing on gut contents and on tissues collected from dead piglets. So you can actually take diarrhea or fecal samples from these pigs and test it via immunofluorescent antibody test for evidence of coronavirus infection. On necropsy, what you're going to see classically is undigested milk in the small intestine, and that should be almost pathognomonic for TGE. The intestines may be thin-walled and dilated, similar to E. coli, but what you're really looking for is that undigested milk. The reason that you see the undigested milk in the intestines is because the virus attacks the villi in the small intestine and causes marked atrophy and shortening of these villi. The animal loses the ability to absorb its food material, specifically the milk, and that's why you see the undigested milk in the intestines and also in the diarrhea. Treatment, as for all viral diseases, is supportive, and control is via isolation of infected pigs, and also there is a vaccine that is very commonly used against TGE. Here's a gross photograph again of a pig infected with TGE, transmissible gastroenteritis. And looking at the small intestinal bowel loops, what you're seeing, these white areas of discoloration here, are actually chunks of milk that are undigested and basically sitting in the intestinal tract. So a very classic description, a very classic photograph of TGE in a pig. So again, we talked about E. coli and TGE, and those are diseases that affect very young animals. They're diseases that will kill some animals and not kill other animals. They're diseases that often occurred in a herd situation, so large numbers of piglets affected. Now we're going to talk about Clostridium. Clostridium perfringens type C is a very common cause of clostridial enterotoxemia in pigs, and this is a disease that affects predominantly the very youngest animals, so the 1 to 2 day old piglets, and it affects a small number of animals versus a herd situation, and causes a very severe bloody diarrhea. So it's almost diagnostic based on the type of diarrhea. These are pigs that when you necropsy them, they're going to die in most cases. Pigs are going to have a lot of blood present in the small intestine, and there may be actually flecks or pieces of necrotic mucosa present in the intestine as well. This is a very, very severe disease that's easily diagnosed either clinically in an animal that has profuse bloody diarrhea or at necropsy in an animal with very severe hemorrhagic enteritis. Histopathology, or also you can do a fecal smear. You may demonstrate a large number of large gram-positive rods in the feces or in a histopath sample. And here's a gross photograph, again, just showing you how easy this disease should be to diagnose. In that there's a very severe hemorrhagic enteritis. It almost looks like an infarcted bowel here. It's very, very severe. So that should be fairly typical or classic for Clostridial enteritis in a piglet. And remember, again, this disease is affecting the very youngest animals, the 1 to 2 day old piglets. Treatment is usually not attempted with Clostridial enteritis because these animals die too quickly. And control is via sanitation, and there is a vaccine against the Clostridium that is commonly used. In a desperation measure, or in some cases as a preventative measure, an antitoxin can be given within minutes of birth, and some farms also employ the use of prophylactic antibiotics, specifically penicillins, to control this disease. So like I said, most commonly this is going to be in an individual animal situation or a few animals affected. Those animals will die. You'll make your diagnosis and then make attempts to sanitize the area and control. Coccidia. Coccidiosis in pigs, again affecting the small intestine, is a disease that affects the young animals. These are animals that are at least 5 to 7 days old, and basically what you see in these pigs is evidence of a fairly significant diarrhea. There will be no blood in the feces. This diarrhea will not be real watery. But an unusual thing, when you measure the pH of the feces clinically, the pH may be acidic compared to E. coli where the pH was alkaline. So a pH of less than 7 may give you an indication that you're dealing with coccidiosis instead of E. coli, although I wouldn't base your whole diagnosis on that. These animals may be very dehydrated because of the diarrhea, again, young animals. And again, what you're looking for is diarrhea in a pig that's at least 7 days old, occasionally 5, but in most cases 7 days of age, because it takes 7 days for this infection to establish itself from the time of birth. When you look at an animal that were to die of this disease, you would see a very severe fibrinonecrotic lesion within the intestine, and I'll show you a photograph of that, I believe. But you don't need to do a necropsy. You can diagnose this very easily in a live animal or right there on the farm, just by simply doing a fecal flotation and looking for oocysts or zooites of the parasite. Treatment or prevention in this case can be done by coccidiostats, such as Amprolium, and control is by disinfection of the farrowing area. Again, this is a disease that affects the pigs at a very young age. You'll see it in pigs that are at least 7 days of age, and both using drugs to control it and also using just basic sanitation can be very effective. And here's what you're looking for. Again, you don't need a dead pig. Basically what you can do is just do a fecal flotation, and what you're looking for is an oocyst, such as this. And this is a fairly highly magnified oocyst. You're going to want to look at about 400x magnification to see these oocysts. And if you have a pig that's clinically infected by Isospora suis, there's going to be a lot of them, and your diagnosis can be very easily made. So remember to do a fecal flotation on a young pig with diarrhea if it's over 7 days of age. Rotavirus. So we talked about a couple causes of diarrhea. Now we'll move into the viral causes. Rotaviruses, specifically a reovirus type, are present in almost all pigs. That's a very ubiquitous virus, a virus that's very common in the environment. It causes diarrhea in animals that are in the post-weaning phase. So we're still looking at the very young animals, but they're probably 21 days and up in age. Diagnosis is difficult. Luckily, it's a very mild diarrhea. And in most cases, it's not going to kill animals. But if you were to look at an animal on a post-mortem situation, you would see the dilated thin walls and intestines again. These animals are a little too old to have E. coli, so you've got to be thinking about something else like rotavirus. You can do histopathology to look for evidence of infection. There's a fluorescent antibody test that can be done on tissues collected at necropsy. And then a technique that is sometimes used is to do electron microscopy on feces from live animals. So they can do, you can send it off to a diagnostic lab. The state diagnostic lab in Kissimmee, Florida, actually will do electron microscopy of feces looking for rotavirus particles. Treatment is supportive, of course. This is a viral disease. These animals may be hypoglycemic, so a little bit of glucose, some fluids, and then some antibiotics to control concurrent infections. And remember to rule out other causes of young piglet diarrhea, such as E. coli and Isospora. These animals should be weaned basically on a good, stress-free nutritional diet, and there is a vaccine that can be given to control herd situations associated with rotavirus. And last but not least, when we talk about intestinal diseases, whether it be small or large intestine, there is one disease that can jump back and forth between the small and large intestine, and that is Salmonella. Again, we talked about it at the beginning, but Salmonella typhimurium and Salmonella cholera suis can cause a severe necrotizing lesion in the small intestine or in the large intestine, and we'll talk about it in a minute in more detail, but it can also cause rectal strictures. So we've moved from the small intestinal diseases, of which there were just a few. Now we're moving into the large intestinal diseases. Again, it's very simple to know what portion of the bowel you're dealing with because the large intestinal diseases tend to focus on the larger pigs. So the first one we're going to talk about is swine dysentery, caused by a bacteria called Serculina hypodysenteriae. This is a disease, again, old pigs, grower-finisher stages. These are the bigger animals that we're seeing this disease in. It can cause significant mortality. Up to 30% of the herd that's infected may die associated with swine dysentery. These are older animals that will have diarrhea, sometimes with flecks of blood. Classically, pigs infected with swine dysentery will have mucus in their diarrhea because this disease is affecting the large intestine. So you will see watery, bloody, and often mucoid diarrhea as the disease progresses. Many of the pigs will recover spontaneously or with treatment, but approximately 30% of them will die. So often your diagnosis will be based on necropsy in one of those 30%. Diagnosis at necropsy, again, we're concentrating on the colon of the large intestine, and you'll see a mucohemorrhagic lesion within the large intestine. So you're looking for a lot of mucus and a lot of blood within the large intestine. Histopathology can be used, so collecting tissues for histopathology to look for classic changes associated with swine dysentery can be diagnostic. And then fecal contents and tissues can be sent to a diagnostic lab for dark field microscopy to look for the spiral-shaped bacterial organisms. So these are spiral bacteria that will show up on dark field microscopy. So that's another possible diagnostic technique. Treatment in a herd situation would be lincomycin. Again, can be used very successfully as a feed additive or a water additive. And control, again, some farms that have a problem with this will use the lincomycin prophylactically in water. A very severe outbreak may be managed by depopulation and repopulation of the herd. The all-in, all-out operations are used to manage this disease as well as the others we've talked about. And the vaccine is not very commonly used because it's not effective in preventing the disease. This is a vaccine that only reduces the severity of the disease, and so it's not very commonly used. Here's a swine dysentery photograph. Again, looking at a portion of the large colon here that's been opened up. A lot of blood and a lot of mucus present within this section of colon. So if the photograph is shown to you or it was described to you in a testing situation, you should be able to pick out that this is as a case of swine dysentery caused by Serpulina hyodysenteria. And clinically, if you're on a farm looking at an outbreak of diarrhea in, again, the aged pigs, the grower-finisher stage, what you're looking for is diarrhea that's very mucoid. And here's a glop of diarrhea here on the ground that has a lot of mucus and some blood in it as well. And that should be very suggestive of swine dysentery as your #1 diagnosis. Another disease of aged animals affecting the large intestine predominantly is Lawsonia intracellulare, or the cause of proliferative enteropathy, or the hemorrhagic bowel syndrome. There are two different syndromes associated with this disease. Again, it affects predominantly the very distal small intestine and the large intestine specifically. It's seen in the grower stage of pigs, so these are animals that are no longer in the neonatal or weanling stage. These are animals that are in the grower stage predominantly. And the clinical signs of this disease are an intermittent on and off diarrhea. It may have blood in it in the very severe cases, and the bleeding can be severe enough in the hemorrhagic bowel syndrome to cause anemia in these pigs. The diagnosis of proliferative enteropathy is probably most commonly and easily done in a post-mortem situation, where you're looking for a classic garden hose gut or marked enlargement of the intestinal tract. These bacteria will actually cause marked hyperplasia and hypertrophy of the large intestine, leading to this very severely thickened intestine and colon. Histopathology, again, or dark field microscopy, may reveal the silver-positive organisms, and they also might show up on dark field microscopy as well. This is a bacteria disease, again, caused by spiral bacteria. Treatment and control, this is a disease that's very sporadic and not commonly seen. There is no specific treatment for this bacterial disease, and it is managed by reducing stress and sometimes by using prophylactic tetracyclines and a product called Carbadox, which I'm actually not sure what that is. It's an antibiotic. I'm not sure of the generic name that's used in medicated feed. And here's a case of proliferative, in this case, proliferative ileitis, but also extending into the colon. So again, predominantly a large intestinal disease, and it causes this dramatic thickening. This tissue should be about 25% of this diameter, and there's a very dramatic thickening, hyperplasia, and hypertrophy of the colon. Now, in many diseases, as we've gone through here, we've talked about looking at diseases, looking at lesions in postmortem specimens. And that's not only because I'm a pathologist and that's what I like to look at, but that's because in the swine industry, that is a very common diagnostic tool because you're dealing with large herds and large flocks for the most part, and animals will die or be sacrificed to make a diagnosis to protect the rest of the herd. So it is a very common diagnostic technique used. Whipworms, another important parasite of pigs caused by a parasite called Trichuris suis. Of course, the Trichuris are the whipworms. These are parasites that are seen again in the older animals. We're looking in the grower phase now for the most part. Parasites that specifically target the large intestine. And clinical signs will include diarrhea with blood and mucus, and can confuse you slightly with some of the other diseases we talked about, such as swine dysentery. The difference between whipworms and swine dysentery is that whipworms can be very easily diagnosed with a fecal float. So once again, when you're working up pigs with diarrhea, it's important to do a fecal flotation. If you're looking at an animal at a post-mortem situation, you're looking for a very severe necrotic lesion within the colon. And again, either touch prep or histopathology or fecal flotation, you will easily see the eggs of the whipworms and make your diagnosis. Fenmendazole or Panacur can be used as a control technique in a herd situation that has a problem with whipworms. And here we have a histopathologic section, and I know none of you in this room will probably be looking at histopathology, but just to demonstrate the fact that you have the parasites. These are nematode parasites up here on the mucosa of the large intestine. And then don't forget to do your fecal flotation and look for the eggs or ova of these parasites to make your diagnosis. And don't forget about salmonella. Again, we talk about salmonella as a multisystemic disease. It's a disease that can affect not only the small intestine, but also the large intestine. Diagnosed by culture fairly easily. Remember that Salmonella, Typhimurium, and Cholera suis are the most common types. It can be in the large intestine or small intestine. It causes a necrotizing lesion. And a classic disease in pigs associated with Salmonella, specifically Salmonella Cholera suis, is the presence of rectal strictures. So if you have an animal that has a rectal stricture, either clinically or again at a post-mortem sample, Salmonella Cholera suis should be a thought. And it is thought that the Salmonella chronically affects the rectum in these animals and causes scar tissue to cause the stricture. So a very classic disease entity in pigs. Rectal strictures associated with Salmonella Cholera suis. Parasites of pigs. Just recap really quickly. We talked about Trichuris suis as a cause of colonic disease in pigs. We talked about Isosporus suis as a coccidial disease of the small intestine of pigs. Ascaris suum is the ascarid parasite that can affect the lungs, the small intestine, and cause the milk spots or scarring spots in the liver. Pigs get a kidney worm, which is a very large worm that's often red in color, called Staphylococcus dentatus. The E is not appropriate. It's Staphylococcus dentatus. And then there's a parasite that has little disease implications found in the small intestine of pigs called Macrocantharynchus hirudinaceus. And that's actually an acanthocephalin parasite, and it's just there for trivial purposes. So, we talked about pneumonia and GI diseases, and those are the most common diseases of pigs by far. But to complete our list, we want to talk about diseases that will specifically target other organ systems, such as the brain. There are 4 diseases that we'll concentrate on: hypoglycemia, strep suis, salt poisoning, many of you may remember, and edema disease, a unique disease to pigs. Hypoglycemia is very commonly seen in newborn piglets. It's easily diagnosed based on clinical signs and measurement of blood glucose at less than 50. So you can very simply measure blood glucose. You come up with a reading of anywhere from 10 to up to 50, and you know you've got a diagnosis of hypoglycemia. What would a pig look like with hypoglycemia? Well, it would be like any other animal. It would be very severely weakened, may be lethargic, may have convulsions, may be shivering uncontrollably, lost its attempt to regulate body temperature. And these animals can show fairly dramatic neurologic disease if the hypoglycemia is pronounced. These animals may also be very cold and hypothermic. Diagnosis, again, as we said, was basically by a blood glucose. If an animal were to die of this, or you would have a suspicion, you'd look to see that the animal had not been eating and had an empty stomach. Treatment is very simple once the diagnosis is realized, and 20 milligrams per kilogram of 5% glucose can be given IV, and the animals can also be warmed to effect a cure in this case. So it's glucose, not glucosa on the slide there. And as far as control of hypoglycemia, in most cases this is due to some sort of maternal neglect or competition amongst the piglets, and that one animal is not getting fed appropriately. So you need to make sure that the milk is flowing from the mother, from the sow to the piglet. Make sure that the appropriate number of piglets are present for the appropriate number of teats. And basically it's a disease that can be easily avoided with good management. Streptococcus suis is another neurologic disease of pigs. Most commonly manifests itself as a streptococcal meningitis, or infection of the meninges overlying the brain by the strep suis, seen in young animals. And these animals can be very severely ill, showing signs of hyperthermia or pyrexia, depression, anorexia, and then a variety of neurologic disease, including tremors and convulsions and even sudden death. Diagnosis is usually made in these cases, unfortunately, at necropsy, where a suppurative meningitis can be easily seen in that there will be a large amount of pus or purulent exudate covering the meninges of the brain. This bacteria can be very easily cultured to confirm your diagnosis. Treatment, again, in a herd situation or an individual animal situation, can be done with penicillins and tetracyclines in the feed or water, or in an individual animal by injection. Control, in most cases, strep suis infections are associated with poor sanitation, can be seen with severe stress in these young piglets and immune suppression. So the control is basically, again, sanitation and minimizing stress, as it is for many of these diseases. Remember, when dealing with an outbreak of strep suis infection, usually it's going to be one or two animals that are affected. It won't be a herd situation. It'll be a very individual animal situation. That it can be a zoonotic disease and can cause meningitis in humans and severe headaches and local skin infections as well. And here's a brain from a piglet with strep meningitis, and basically showing there's marked reddening of the meninges. And if you were to cut into these meninges, there would be a large amount of pus that would flow from them. So kind of a nasty diagnosis, but one that's very easily made. Salt poisoning. Salt poisoning is used as a classic disease in veterinary school, and many of us may remember that salt poisoning is associated with, usually with water deprivation, most commonly seen in the wintertime where water buckets will freeze, and these animals are deprived of water, causing the CNS to become hyperosmolar. When the animals regain access to water, they very quickly will drink a large amount and cause severe swelling of the brain, and will also cause an eosinophilic inflammation of the brain. These animals will be very thirsty. They may be constipated because they're dehydrated. Again, they're reintroduced to water, and then they very rapidly develop neurologic disease, sometimes progressing to death. Diagnosis is usually made based on history. On clinical pathology, you may see a lack of eosinophils in the blood, and that's because all the eosinophils in the body have gone to the brain to cause this eosinophilic meningitis. So an eosinopenia is classically seen in the blood work. And then if you do histopathology, which in most cases you won't, you will see an eosinophilic meningitis and encephalitis. To control salt poisoning, basically you want to limit salt intake in these animals and make sure they have free access to water. It's a very simple disease, and it's not seen very commonly anymore at all. Edema disease is a disease that is unique to pigs. It's caused by an E. coli. It's not the same E. coli that causes the gut lesions. It's a specific E. coli that secretes a specific toxin called the Shiga-like toxin. This Shiga-like toxin actually attacks the blood vessels of the pig and causes the blood vessels to become very leaky. It's seen in young animals, usually 1 to 3 weeks post-weaning, so we're in that 3 to 6 week age group. The clinical signs of edema disease are almost always severe neurologic disease and acute death. What you can diagnose this disease very easily by doing is simply to look at the animal and look for evidence of widespread edema. The most classic sign of edema disease in pigs is a severe swelling of the eyelids. If you were to cut into those eyelids, they would leak edema fluid. And it's a very classic textbook disease. Here's a pig, not a very good picture, but a pig, a head that's been split down the middle with a knife trying to demonstrate the edema within the tissues, and that doesn't show up very well. But what you can appreciate, look at these eyelids. The eyelids are extremely swollen and are very much protruding from the head over here and over here. And this is pretty much pathognomonic, classical for edema disease caused by the Shiga-like toxin of E. coli in pigs. Treatment, as I said, this is a very acute disease. These animals die very rapidly, and it's an uncommon disease for the most part. and treatment is usually not attempted. Control, if there is a recurring problem with this disease, the penicillins and tetracyclines are not real effective in the feeding water, but in some cases are tried to control the disease. And there's been some association with this disease and low-fiber diets, so that some farms use the high-fiber diet as a control technique, although I'm not sure what relation that has to this disease. It's something that was classically written in the textbooks. Just remember the swelling of the eyelids and the palpebral edema for edema disease. And then one disease that we talked about at the beginning, again, not to forget about, is pseudorabies as a neurologic disease, again, predominantly in young piglets, up to 100% mortality in the young animals. Musculoskeletal diseases is the next organ system. So we're looking specifically at diseases that affect the joints and the muscles. Causes of arthritis in pigs are simple and straightforward. And arthritis in pigs is fairly common, especially animals that are housed on concrete surfaces in a production facility. These animals were not designed to live on concrete, and that can be very detrimental to their joints. You may see evidence of osteochondrosis dissecans in young pigs or OCD lesions, but not very commonly. Far more common are the bacterial causes of arthritis in pigs. Strep suis, we mentioned as a brain disease, can also cause arthritis. Erysipelas, we mentioned already and talked about, also can cause arthritis. And Actinomyces pyogenes is a third cause of arthritis in pigs. These three bacteria often cause a severe suppurative arthritis. Mycoplasma is more of a chronic arthritis. We'll talk about that in more detail. And then there are a couple diseases of the muscles, one of which we've already talked about. Some bone diseases that affect pigs include rickets in young animals, a new condition that's been described called fibrocartilaginous infarcts of pigs, and osteochondrosis, which is OCD that I just mentioned to you. Suppurative arthritis. These are pigs that are going to present with very severe swollen hocks in most cases. The hocks will be warm to the touch, very fluctuant, and very severely swollen. If you were to notice this clinically, you want to think of three bacteria as differential diagnoses: the Strep suis, Erysipelas, and Actinomyces. These are the causes of suppurative arthritis in pigs. They may damage the cartilage just associated with the very severe inflammation. These are usually due to some sort of systemic spread of bacteria to the joints associated with tail clipping, some sort of surgical procedure. They may be due to fight wounds, and basically the spread of bacteria from the bite site or from the surgical site to the joints, causing the severe suppurative arthritis. The joints, again, will be very distended. They may abscess out. They'll be very warm to the touch. And you can attempt treatment, and if you catch it in the early stages, treatment may be successful. But in the late stages, these animals may be very severely lame and need to be sent to slaughter. Here's not a very good picture of suppurative arthritis, but we're showing an intact bone and joint capsule here that's very smooth and nice looking, and then a tremendous amount of suppurative exudate around this joint that's actually flowing from the joint that's been opened up. So you see a suppurative arthritis, lots of neutrophils. You can do cytology on these joints and look for bacteria, and should be fairly easy to see the bacteria, but you've pretty much got your diagnosis narrowed down to one of three bacterial pathogens. In contrast to those more acute suppurative lesions, pigs also have a unique mycoplasma that attacks their joints. Mycoplasma hyosinoviae is a disease that's seen in pigs that are 4 to 12 weeks of age. It's seen in pigs that usually they show evidence of chronic lameness. It's mild to moderate lameness. And it's a non-suppurative lesion. So if you were to aspirate a joint or tap a joint, you would see evidence of lymphocytes, macrophages, maybe some plasma cells in your cytology sample. The synovial tissues may be very severely swollen in that the bacteria will localize on synovial tissues. And in a herd situation or in an individual animal, you can use lincomycin to treat in the feed or in the water. And here's a pig with chronic arthritis. It's not very severe. You can see there's minimal swelling of this joint here, but there is some swelling. This joint would probably not be real hot to the touch. There would certainly be no abscessation. The animal could be treated based on your clinical suspicion, or cytology of the joint could be performed to rule out the three other bacteria that we talked about. So a fairly straightforward diagnostic technique. Malignant hyperthermia is a disease that's classically described in pigs, also called the porcine stress syndrome or pale soft exudative pork. It's an autosomal recessive genetic disease where most pig breeders are trying to breed this out of this herd. And it's basically some sort of severe stress predisposes these animals to muscular breakdown and damage. That stress can be fighting, some sort of movement, severe handling or processing, and last but not least, it's classically been associated with halothane anesthesia. And that's an old time, probably not too many people use halothane anymore, but it's something to remember for a classic textbook reason. Clinical signs of malignant hyperthermia are most commonly seen associated with tremors of the muscle. If the diaphragm is infected or affected, you may see evidence of respiratory distress. Malignant hyperthermia is treated simply by removing the stressful event, by cooling the animal down to reduce its body temperature, and the compound called dantrolene has classically been described as a control technique to reduce the signs associated with malignant hyperthermia. Control is basically genetic selection. There is a DNA probe test out there to try and reduce the incidence of this autosomal recessive gene. Remember that this is a genetic disease transmitted by an autosomal recessive defect. Here's an example of a cross-section through the lumbar muscles of a pig, showing you this very pale, very soft, friable muscle right here. So pale, soft, exudative pork, malignant hyperthermia, or porcine stress syndrome, all associated with a genetic defect. We've talked about white muscle disease, vitamin E selenium deficiency several times. Again, remembering Midwestern diets, propionic acid, decreased vitamin E selenium, heart disease, and muscle disease, all as components of this syndrome. Again, diagnosis is by looking at heart, muscle, liver, looking for evidence of heart failure, muscle damage, and measuring liver selenium concentrations. And once again, you've seen this picture already. It's showing you pale areas in the heart up here. Rickets. Rickets is a bone disease that's commonly seen in young pigs that are on improper diets, associated with improper calcium-phosphorus ratios, or perhaps a deficiency of vitamin D. You may see decreased mineralization of the bone. These animals clinically may present with pathologic fractures, or fractures that happen for no apparent reason. The bones may be bowed or distorted, and these are animals that, unfortunately, the damage has been done. If they're not severely lame or not severely affected, they can be managed to slaughter age. However, some animals may be so severely affected that they need to be euthanized at that point. And of course, this is controlled by making sure that you have an appropriate diet, looking at appropriate calcium and phosphorus ratios of at least 2 to 1, and maintaining appropriate vitamin D and exposure to sunlight, which in some intensive herd operations can be very important to make sure these animals get exposure to either high-frequency UV light or natural sunlight. OCD, similar to our large breed dogs, is seen in animals that are rapidly growing, large animals, and usually involves the elbow joints. So OCD lesions in pigs usually involve the elbow joints, less commonly the knee or the stifle. Fibrocartilaginous infarcts have kind of come into fame recently as a cause of pretty significant disease in pigs. And these are pigs that have been grown so fast and so rapidly to such a large size that basically their spine has a very difficult time dealing with this. These animals are very large, fat pigs, as shown by my cartoon up here, and they're shipped off to slaughter in most cases. And when they arrive at the slaughterhouse, they're down in their hind limbs. They cannot walk on the hind limbs. Of course, those animals are now condemned and cannot be used in the food chain, and there's a dramatic economic loss. These animals may have evidence of discospondylitis or fusion of the vertebrae. There's evidence of nucleus pulposus rupture, so similar to intravertebral disc disease in other species. And what happens is this ruptured material actually will embolize and cause damage to the spinal cord. So again, it's heavily muscled, very fat pigs that are shipped, usually on a truck, bounced around on the truck, and basically rupture an intravertebral disc, causing hind limb lameness and condemnation. Musculoskeletal diseases, again, very simple, very straightforward. And now we'll move on to repro. Reproductive diseases in pigs are fairly important. As you can imagine, these are animals that are supposed to be highly fecund and produce a large amount of piglets. And any of these diseases that affect reproduction can have serious economic results. Porcine parvovirus is a very common viral disease in pigs. It's thought to be endemic in most herds and manifests itself in times of severe stress, poor management. If animals aren't managed appropriately, you may see outbreaks of porcine parvovirus. The clinical disease that you will see depends on at what stage the sow is infected, and it's very similar to bovine virus diarrhea in that gestational age is important to what you see. If the fetuses are infected at less than 30 days gestation, they're simply resorbed. The animal, the sow, will come back into heat, and the only thing that will be reported to you are abnormal estrus cycles. If the piglets are infected or the fetuses are infected at 30 to 70 days gestation, they may mummify in various stages of gestation. And that's classically where you'll see the lesions that are associated with porcine parvovirus. Piglets that are affected in late gestation, greater than 70 days, may survive, but they'll be very weak and usually die a short time after death. You won't see any other signs of illness in sows affected, so this is purely a reproductive disease. The classic descriptor for porcine parvovirus is SMEDI, or stillborn mummification, embryonic death, and infertility. So you'll see animals that are stillborn, you'll see mummies, you may see embryonic resorption, and reproductive abnormalities. Diagnosis can be done by looking at mummified tissue and looking for evidence of immunofluorescent antibody titers, or by rising titers in the sow during reproduction. And here's a classic photograph of SMEDI, porcine parvovirus infection, showing you mummified fetuses from various stages of gestation from one sow. So if you're seeing various sized mummified fetuses, the first thing you should think about is porcine parvovirus. Control, basically some farmers will vaccinate or allow gilts to be infected. Gilts are animals that have not bred previously prior to breeding. They will commingle the gilts with the sows to allow animals that have been infected to infect their new reproducing animals, again, to allow the animals to become immune. Some farmers will actually grind up mummified fetuses and feed them to gilts in order to auto-vaccinate these animals. But there is an appropriate vaccine that can be used with some success. Leptospirosis, of course, is the cause of reproductive disease in pigs, with Leptospira interrogans being the most common cause. These animals may show evidence of hyperthermia or pyrexia, and you most commonly will get late trimester abortions or stillbirths associated with lepto infections in pigs. Dark field microscopy and serology are the most common diagnostic tools for lepto. And lepto is not a very common disease in pigs, but it is out there. Treatment for lepto, if you do diagnose it, the chlorotetracyclines or tetracyclines in the feed. And there is a vaccine, although, like I said, this is not a very common disease. It is vaccinated for to prevent it in the swine industry. PRRS virus, we mentioned already, as the cause of porcine reproductive and respiratory syndrome. This is a disease that you'll see respiratory disease as well as the reproductive disease. You'll see premature farrowing, so pigs that are early fetuses that are being born. You'll see stillborns, mummies. You'll see changes in estrus cycle, abnormal estrages, and basically serology can be used to diagnose it in a reproductive animal, or in an animal with respiratory disease. You can use histopathology and immunofluorescent antibody testing once again. Vaccination is used as a very common control technique or prevention in PRRS, as we mentioned at the beginning. Brucellosis, don't forget about Brucella suis as a cause of abortion in pigs. Not very common, although it is seen sometimes in wild swine herds and can be transmitted to backyard flocks. And you may see evidence of endometritis, or in boars, the classic association with brucella is a severe orchitis. And here's a classic picture of a boar with orchitis showing a massively enlarged left testicle. Serology can be used, the same card test that we use for brucella in cows. And this is a test and slaughter disease for the most part. So animals that are infected are slaughtered. And remember that brucella is always a possible zoonosis. So when you're looking at a pig herd and you're dealing with abortions and stillbirths, the first disease you should consider is parvovirus. Then concentrate on PRRS. Pseudorabies, don't forget about pseudorabies as a cause of stillbirths and abortions in pigs. And then leptospirosis is probably the fourth most common cause. So that's a good differential list there for dealing with abortions and stillbirths, which is a very common thing when dealing with pigs. Skin diseases. We're getting close to the end here, and we'll talk real quickly about some skin diseases. Very simple and straightforward as far as diagnosis for the most part. Sarcoptic mange, greasy pig disease, swine pox is not very important. We have already talked about erysipelas, and then a new disease I'll describe to you. Mange, caused by sarcoptic scabiei, various suis. Young pigs with intense pruritus. These are pigs that are going to be extremely itchy and may rub their skin off if they're so pruritic. These are pigs that are not going to gain weight because they're spending too much time itching. And diagnosis can be simply made by a skin scrape. Treatment, again, very simple, using ivermectin injectably or topically to control the mange mites. Here's a mangy pig showing a large area of hair loss and hyperemia of the skin. Another pig, kind of just a ratty appearance with some hair loss and hyperemia of the skin. Diagnosis very simply made with a skin scrape. So don't forget in the young pig with skin disease to concentrate on your skin scrapes. In contrast to the sarcoptic mange, a very common disease is greasy pig disease or exudative epidermitis caused by Staph hyacus. A very classic disease in post-weaning or pre-weaning pigs, right around that weaning period that they're infected. This disease does not itch, it is not pruritic, and can be easily differentiated from sarcoptic mange. You may see exfoliation of the skin, you may see seborrhea, and the classical descriptor of greasy pig is a very good one. This disease can be easily diagnosed with a skin culture, looking for Staph hyacus. And here are a couple greasy pigs. Here you can pick out the greasy one amongst the less infected ones. And here a very severely infected pig. Treatment for greasy pig disease, injectable penicillins can be used, oxytetracycline, and tetracyclines in the feed are very commonly used in a herd situation. This is a disease of sanitation, a disease associated with certain external parasites such as swine lice, and you want to control the sanitation of the farrowing area as well as any external parasites to reduce the incidence of this disease. Swine pox. This is a disease that you just need to know about for trivial reasons. It's not really that important from a management standpoint. It's caused by a pox virus. It's in young animals, as most pox viruses do affect young animals. You may see pustules and papules and little crusts. And basically, you diagnose this based on clinical signs. This animal will not be pruritic, will not be itchy. You can biopsy the lesions, but treatment is not necessary, and in most cases you recognize this disease for what it is, you ignore it, and the lesions will spontaneously regress with no treatment. So here's a case of swine pox. It doesn't bother the pig. It looks a little unsightly. Little lesions here all over the shoulders and arms of this pig. Again, they're pustules and papules for the most part, very slightly raised, are not pruritic, do not cause the pig any danger, and they will resolve magically after several weeks. Erysipelas. We can't, of course, forget about erysipelas as the cause of diamond skin disease. Any age pig, usually associated with some sort of skin wound or skin contamination. What you're seeing are large areas of hemorrhages associated with bacterial thromboemboli in the skin. Again, don't forget about the arthritis and endocarditis associated with this disease. And the diamond skin lesions are pathognomonic. So if you see those lesions, you've got a diagnosis. You can culture it to confirm, but you really don't need to. And just so we don't forget, again, our blotchy, patchy areas of skin lesions in diamond skin disease. Very classic disease. Treatment, if you have an animal that you can treat, you can use penicillin. And again, it's a sanitation problem in most cases, some sort of skin wound, and you control it by controlling sanitation. There are vaccines that are not commonly used. PRRS virus. PRRS virus has recently been described associated with some skin lesions. It's thought to be associated with a type 3 hypersensitivity reaction, and these animals present with dramatic skin lesions, and it's just one of those things you got to know that the animal may be infected with PRRS virus. It's usually a vasculitis that you see, and you'll see a very severe cutaneous infarction, usually over the hindquarters of the pig, and there may be kidney disease associated with it as well. And again, it's a hypersensitivity reaction that attacks blood vessels, both in the skin and the kidney, associated with PRRS virus infection. Here are two pigs that have been clinically affected, and you can see it's a very dramatic disease. It's a very characteristic disease affecting predominantly the hindquarters for whatever reason. Here and here, large infarcts in the skin, and very severe disease. Again, you may see concurrent kidney disease in these animals, and also respiratory disease in these animals, because it is the PRRS virus. It's a hypersensitivity reaction, thought to be a type 3 hypersensitivity reaction. So those are the skin diseases that we want to talk about. Again, very straightforward: mange, staph, erysipelas, and then the PRRS virus. Very easy to diagnose for the most part and should be fairly straightforward. Miscellaneous disease that I just want to mention doesn't really fit into any organ system. Baby pig anemia is very common, associated with iron deficiency in pigs. The piglets have a very high iron demand at a young age, and you may see anemia within 2 to 3 days of birth. This is controlled very standard. It's very standard in the industry to give pigs iron dextran injections at 1 to 3 days of age. So it's a very simply controlled disease. Pigweed, again, a disease that we could put it in the respiratory section, but it's just one of those things you got to know about. It's a toxic plant. The species is probably not important: Amaranthus rectiflexus, southeastern United States, and classically, textbook causes a perirenal edema, so severe fluid accumulation around the kidneys. Fuminensin or fusarium infection. This is a fungal infection that typically grows on the feed material, and is a cause classically in pigs of hypertension. So if you think of fuminensin or fusarium fungal growth on the feed of pigs, these are animals that get very severe hypertension. The arteries and arterioles will become proliferative and very hyperplastic, and then you can see a very severe pulmonary edema associated with fuminensin exposure. So again, not a very common thing, but it's one of those pig diseases that's described in the textbooks, and you should probably be aware of. Fuminensin infection causing hypertension and pulmonary edema. Last but not least, we're getting really close here now, is the foreign animal diseases. Don't forget about hog cholera and African swine fever. We mentioned that these are viral diseases that specifically target the blood vessels of the animals. The classic lesion associated with hog cholera is a splenic infarction, and you'll see basically the small picture here on the right are numerous splenic infarcts, these dark black areas. Kind of hard to see on the small picture, but just remember splenic infarcts. And then African swine fever also causes a vascular lesion, and classically what you get is this turkey egg kidney. So it's a kidney with lots of little purple spots in it. So if you were to necropsy a pig and see evidence of splenic infarcts or evidence of hemorrhages in the kidney, you should keep in the back of your mind these foreign animal diseases and perhaps be thinking about calling the state veterinary authorities. Last but not least, some diseases that have been in the news recently and that are important for all of us to remember are the vesicular diseases. Remember that swine are rather unique in that they can be infected by all of the vesicular diseases: foot and mouth disease, swine vesicular disease, vesicular exanthema, and vesicular stomatitis. It may be important to remember what kind of viruses these are, foot and mouth being an aphthovirus, swine vesicular disease being an enterovirus, vesicular exanthema being a calicivirus, and vesicular stomatitis being a rhabdovirus. Vesicular stomatitis is found in the United States, of course, and hopefully we won't see foot and mouth disease in the United States, but of course it's become very important around the world. All these diseases look similar. with erosions and ulcerations on the distal ends of the limbs and feet, and often on the snout of pigs. And pigs are very susceptible to all these diseases and certainly should be monitored for the vesicular diseases. So I think we're finished, and here's our orchitis brucellosis pig again. We'll use that as an ending to basically wrap things up and say thank you for paying attention to me for the last couple hours. We're going to have a question and answer session in the next, I guess it's the next couple weeks to a month, where I'll be available to answer your questions about pigs. I may be able to answer some questions about some of the exotic animals that you have any questions about, any zoo exotics, perhaps even fish diseases. I'll bring some textbooks that I can show you, some outlines that I can show you that might help you study a little bit. But remember, the systemic thinking in pigs, thinking by body systems, thinking by organ systems, and keeping your diagnostic techniques very simple and straightforward. Remembering that if you're given the choice on the test to do a postmortem exam, that often in the swine industry, that's how you're going to get a diagnosis, and that should be one of your very commonly used diagnostic tools. So thank you again, and I think we're done.